Page 6, Lecture 1. Drug and Substance Abuse. Understanding drug and substance abuses is important if one is going to develop a drug abuse prevention program in a community. It is also important that one knows what are the various drugs that are being used in the community, where one comes from, what their effects are, and by which names they are known. This lecture will give you information about drug and substance abuse, what drugs are, and the various drugs found across the world. As we look at this, we shall be concerned that drug abuse is one of the major social problems in Kenya with common and easily identifiable manifestations in public health. The United Nations Office of Drugs and Crime reported in 2004 that half of drug abusers in Kenya are aged between 10 to 19 years, with over 60% residing in urban areas and 21% in rural areas. What is a drug? Drugs can be defined as any product other than food or water that affects the way people think, feel, see, and behave. They are chemicals that affect the body and brain. These drugs can enter the body through chewing, inhaling, smoking, drinking, rubbing on the skin, or injection. Drugs are not only substances that cause problem or are abused by people. There are substances that, for one reason or another, are not thought of as drugs, for example coffee and tea, but they also contain chemicals that can be defined as drugs. What is drug and substance abuse? Drugs and substance abuse refer to the use of illicit drugs or the abuse of prescribed drugs or use of over-the-counter drugs for purposes other than those for which they are indicated or in quantities other than directed. While prescriptions are legal, the abuse of a prescription can still be called drug abuse. Illegal drug abuse differs in that it refers to the use and/or abuse of any illicit drug, such as heroin, cocaine, or marijuana, bangi. What is drug addiction? Drug addiction refers to a situation whereby a person's body can no longer function without use of substances. The addictive substances usually have negative effects. For example, they can alter mental state and behavior to a point where the individual becomes a threat to himself and others. Once a person becomes addicted, it is hard to function without using drugs or the substance.
Page 7. Many people get addicted because of curiosity, thinking that by only taking a cautious and occasional trial on drugs they will not develop into uncontrollable abuse. However, with time they get addicted and are no longer able to quit voluntarily. Discussion question 1.1 Identify some of the drugs used in your community and discuss why it is important to learn about them. Commonly used drugs. Drugs have been classified into 6 categories, which are 1. Gateway drugs. These are legal drugs that a non-drug user might try and lead her to more dangerous drugs such as marijuana. Teenagers who engage in early smoking and drinking, which are gateway drugs, have higher chance of using and experimenting with more dangerous drugs. 2. Depressant drugs. These drugs slow down a person's central nervous system, brain, spinal cord, nerves. Doctors commonly prescribe depressants to help people who have anger management issues, stressed, or tensed. Depressants relax muscles and nerves. These drugs make patients feel sleepy and lightheaded. Examples are alcohol, barbiturates, and sedatives. 3. Stimulant drugs. These drugs speed up a person's central nervous system. They have an opposite effect of depressants. They make a person's energy high. Their side effects are depression and tiredness. Examples are caffeine, nicotine, cocaine. 4. Narcotics. These are drugs which relieve pain and induce sleepiness. They are prescribed to patients with mental disorders or with patients dealing with severe pain like cancer. These drugs are illicit and dangerous if taken. Examples are cocaine, heroin, and marijuana. 5. Hallucinogens. These are drugs that alter a person's awareness of their surrounding as well as their own thoughts and feelings. They distort reality and facts. They affect all senses and make a user feel, hear, see things that don't exist. This name comes from the word hallucinate, to perceive illusions. Examples are lysergic acid diethylamide, psilocybin, obtained from mushrooms, and mescaline.
Page 8, 6. Inhalants. These drugs are found in ordinary household chemical products and anesthetics. They are readily available and accessible to young children. Examples are acetone, spray paints, cleaning fluids, and air conditioner fluids. Discussion question 1.2 Identify some of the gateway drugs in your community. Commonly used drugs in Africa. 1. Paracetamol, acetaminophen. Paracetamol is an analgesic, pain-killing drug which is used in treatment of mild to moderate pain. It also used in reducing fever. Paracetamol is an over-the-counter drug, OTC, and the most used pain-relieving drug all over the world. The normal adult dose of paracetamol should not exceed 4 grams in a day, and it should be taken just for 3 days. A paracetamol overdose can cause severe liver damage, this being the reason why care must be taken when handling it. 2. Marijuana. Marijuana is one of the most used illicit drugs in the world. In Africa today, millions of youths between the ages of 16 to 36 years smoke marijuana. It is addictive and has harmful effect on the brain, such as a decrease in mental ability for those who started as teenagers, and other effects such as dry mouth, red eyes, paranoia and anxiety. 3. Tramadol. Tramadol is a painkiller which is used in the treatment of mild to severe pain. Some people use tramadol as an aphrodisiac, that is a drug that increases libido, making it as one of the most abused drugs today in Africa. 4. Heroines, cocaine and other narcotics. Narcotic analgesics, painkillers, are commonly used in the treatment of moderate to severe pain, especially in terminally ill patients. Narcotics are highly addictive because they change the chemistry of the brain. People take narcotics for its ability to reduce pain, create relaxation and for immediate euphoric, joyful effect. Narcotics should be discouraged except for clinical use, and those who are indulging in taking it should be encouraged to go for drug rehabilitation.
Page 9. 5. Dexamethasone. Dexamethasone is a drug used in the treatment of many conditions such as rheumatoid problems, severe allergies, skin diseases, asthma and chronic obstructive lung diseases. There are young people who ignorantly use dexamethasone for the purpose of adding weight, but unfortunately it causes a retention of sodium in the body which brings about an accumulation of fluid, and this can result to some disease conditions such as diabetes mellitus, hypertension and some other disease conditions. 6. Non-steroidal anti-inflammatory drugs, NSAIDs. These includes diclofenac, ibuprofen, piroxicam, naproxen, tenoxicam, etc. This class of drug has 3 properties, namely analgesic, pain-killing, anti-inflammatory and antipyretic properties. They are commonly used for disease conditions such as arthritis, osteoarthritis, dysmenorrhea, painful menstruation, etc. NSAIDs are one of the most abused drugs in Africa because of easy access. NSAIDs should be used with caution because of various adverse effects such as ulceration, heart problem and kidney problems. 7. Alcohol. Alcohol is understood to be the oldest and commonly abused substance. The traditional brews were prepared by fermentation. Examples are Basar, Mnazi, Muratina, etc. Others were prepared through distillation such as Changar. Today the same modes are used but done with a new technology. Distillation is used to produce whiskey, vodka, rum, etc., while alcohol is manufactured in factories using ethanol, which is commonly known as the third-generation spirits. 8. Tobacco and tobacco products. Tobacco comes in many forms, cigarette being the most common. Tobacco can be chewed or smoked. Sniff is powdered tobacco. The principal agent that is common to all forms of tobacco is nicotine, which is a powerful addicting drug. Most people who smoke know about the dangers of tobacco, but they continue using it because of the addictive nature of nicotine. 9. Cat. Cat, also known as Mirar, Kijiti, Gomba, Mirungi, or Vive, is harvested from a tree that grows in the eastern African highlands of Ethiopia, Somalia, Tanzania, and Kenya. In Kenya it is grown particularly in the Meru area. Cat is classified as a stimulant drug such as tea and coffee. As we noted above, they alleviate mild degree of fatigue, although they develop low levels of dependence. The withdrawal effects are limited to headache and fatigue.
Page 10. 10. Inhalants. Inhalants are substances which are not usually considered as drugs. They include petroleum fluids, gasoline and kerosene, glue, paint thinners, cleaning fluids, aerosols, dry cleaning fluids, alcohols, e.g. methanol. These substances are easily available and relatively inexpensive. Inhaling of these substances causes numerous health problems such as persistent cough from the continuous inflammation of the respiratory tract, loss of appetite, anemia, damage to the brain, nervous system, bone marrow, kidney, blood vessels and liver damage. As we have seen in this lecture, drugs are not only the illicit drugs but also prescribed drugs, drugs given by doctors. Also, on the list are drugs that we use for self-medication such as Panadol, diclofenac, ibuprofen, piroxicam, naproxen, tenoxicam, aspirin, etc. These are drugs which a person usually buys over the counter in a chemist. What should be noted is that there is misuse of both prescription and non-prescription drugs. Anytime a legal drug is prescribed unnecessarily or taken needlessly, it is being misused. Most commonly abused over-the-counter drugs are cough syrups and painkillers. Young people are today buying cough syrup and taking them in large doses. Others are barbiturates which cause drowsiness, sedation or pleasant relaxation, such as sleeping pills, which some are known to produce euphoria. Discussion question 1.3 Identify some of the prescribed drugs that are abused and explain how this kind of abuse can be minimized.